As Canadians pause to honor those who served, some are pointing to ongoing issues with the support veterans receive. In a recent Veterans Affairs Employee Union survey, many report being overwhelmed by the number of veterans assigned to them. They felt they couldn't properly provide the support that they needed. So what is being done to address this? Virginia Vaillancourt is the National President, Union of Veterans Affairs Employees. She's in Victoria. Ms. Vaillancourt, thank you so much for joining us. Describe to us the staffing challenges that Veterans Affairs employees are facing.
Well, the staffing challenges that staff at Veterans Affairs have been facing, unfortunately, has been going on for way too long. We've been raising this as an issue dating back even before 2015, when the Conservatives cut a lot of staff from our department. And last year, I actually wrote to the Minister of Veterans Affairs requesting a meeting to be able to talk about the concerns of the case managers due to the high caseloads and the impact that it was having on our case managers. Case managers are feeling overwhelmed, they're frustrated. They want to be able to provide that exemplary client service to our veterans, and they're not able to do it because they don't have the proper amount of staff to meet the needs of our veterans based on our mission statement for Veterans Affairs. And we've got case managers that are burning out, case managers that are leaving our department and going to other departments or joining the public sector instead. They are frustrated. They need more case managers. It's a simple request. I saw the media story yesterday of the minister noting that he was vowing to hire more staff. We've been listening to this for way too many years. It's disappointing to see that they know the concerns. They know that the case managers are burning out. They know that we have veterans that are falling through the cracks, and yet we're not getting the staff that we need to be able to meet the needs of our veterans.
Can you sort of illustrate what this looks like on the front lines in terms of case managers and how many veterans they ideally would be working with versus what they actually are working with?
So ideally, they'd like to have the max of sort of 25. And again, that depends on the complexity of the client. Right now, some of our case managers across Canada are carrying caseloads of over 40. And in some areas, I've spoken to case managers who have upwards of 55 plus clients that they're trying to case manage.
So what are the consequences of this staffing crunch? What does this actually mean for veterans?
It means that veterans are continuing to wait longer to get the services and benefits that they need. They're waiting to be able to speak to their case manager because the case managers with 50 clients, it's very hard to be able to get to the needs of all of our veterans in a timely manner. And we've seen, unfortunately, too many veterans fall through the cracks and too many case managers burning out because of it.
Can you tell us the types of services that these case managers help deliver to veterans? How do they sort of go about their operations?
So it's kind of hard to put what the case managers do in a very small box, I guess, given the work that they do. The case managers have to build a rapport with the clients. They do in-depth interviews with the clients. They try and build that relationship with the clients, but also with the families. They do client assessments. They look at the client's financial, their health, both mental and physical. They look at the psychosocial aspect of the client's needs. Then they work with the client to develop a plan to help meet the needs of the client through the different programs and services that Veterans Affairs has. And then what they do is they liaise not only within the department, but they also liaise outside of the department in community groups, private organizations, to ensure the coordination of the services that the veteran needs, whether it be vocational rehab, physiotherapy, or a psychologist. The case managers are that point of contact for the clients.
When was the last time you were able to get a meeting with Veterans Affairs Minister Lawrence MacAulay to discuss this?
So my last meeting with the minister was in March of 2020, and I followed up with a letter after that. And unfortunately, I've not received a response to that letter.
So these problems continue to exist in the system, and you still can't get a hold of the minister. Why do you think that is?
I honestly don't know why the minister will not work with the union, considering it is part of his mandate that was issued by Justin Trudeau. In both of his mandates, he's supposed to work with us. And unfortunately, we don't see that collaboration and coordination with us. We've offered to meet to discuss and come up with a plan together to meet the needs of the case managers and our veterans. And I just recently sent another letter again asking for another meeting, because this cannot continue to go on. Our veterans need the services and benefits, and our case managers need more case managers to be able to meet the needs of those veterans.
We reached out to the minister's office for an interview today, but they declined our request. A spokesperson sent out this statement. It says, "We recently invested nearly $200 million to hire the staff required to deal with the increased number of veterans applying for benefits and services. And we are committed to, during the campaign, we will continue to hire more staff, including the frontline case managers who work directly with the veterans in need of the most support." When you hear that, what do you make of that statement? And is that an adequate answer to the challenges you're putting to the ministry?
No, unfortunately, because it's the same messaging that we've been hearing dating back into 2015, when we were promised more case managers and a 25-to-1 ratio. Even Veterans Affairs notes that the 25-to-1 is the elephant in the room. Nobody knows how at this point they're going to get there. They talk about hiring staff, but we haven't seen it. It's the same message that we've been going and hearing, unfortunately, for 6 years, and we're still hearing the same promises.
The last thing I want to ask you about is, are you seeing an increase in need for services, particularly for veterans who are struggling with their mental health, for those who served in Afghanistan, watching what's happened in Afghanistan as the country fell to the Taliban?
Absolutely. Our veterans need more services and benefits. And with the backlog of cases that are coming through the disability applications, those veterans, once the applications are approved, those veterans are going to need case management services. The time to fix that was 6 years ago, and we need to get those case managers in place now. The veterans need them now, not 6 years from today.
Ms. Vaillancourt, thank you very much for your time today.
Thank you, Katie.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.